Now I want to start off with some new information from the UK. So welcome, it is most definitely Wednesday, the 27th of May. And then after we've looked at the UK, I've got a bit of a surprise for you, and then we've got some other information of interesting and some concerning developments from around the world to think about as well. So let's start off with a quick review of where we are globally at the moment. Now, 5.5 million confirmed cases in the world, 351,000 confirmed deaths, and of course we know the real numbers are significantly higher. Now in the UK we're over 250,000 confirmed cases, but again we know the real number is perhaps 10 times that, and we'll see some information that tells us that shortly. Deaths in the UK, including hospitals, care homes and everywhere, 37,130 deaths now, which are attributable to COVID-19. And the majority of these deaths occurred prematurely because of COVID-19. And we know from previous data from the Office of National Statistics that of people that die with COVID-19 on the death certificate, about 95% the COVID-19 is the precipitating actual cause of death. And at about 5% the diagnosis is coincidental to the death. So the vast majority of these deaths are directly caused by COVID-19 infection. Now, better news, shops are reopening from the 15th of June. So it's a few weeks away yet, but they're planning on a fairly full reopening of shops then. But there's going to have to be limited amounts of customers, so there's going to be quite a bit of queuing outside, or as you say in America, standing in line outside waiting to get in. There's going to have to be one-way flows. We're going to have to discourage shoppers from touching things, then putting them down again because of the potential cross-contamination. And fitting rooms for closed shops are going to be closed because we can't have people trying on clothes and then putting them back again for the time being either. And this is going to be replaced with regional targeted lockdowns when it's necessary, as indicated by the testing, tracking and tracing approach. So anyone with symptoms should be tested. That facility is virtually there now. They would then be tracked to see where they'd been, and their contacts would be traced so that they could be advised to self-isolate for 14 days. So what we're seeing is a more targeted approach rather than the more blanket lockdown we have at the moment. So that makes sense. And of course, this is the way that all countries around the world are currently, or many countries around the world are currently going at the moment. Now, Office for National Statistics data from yesterday, deaths in England and Wales. And obviously I always put in the link so you can check the data for yourself. Now, this data goes up to week 20, which is the week ending the 15th of May. This is data up to week ending the 15th of May. And on that week, there were a total of 14,573 deaths. The week before, week 19, the weekend in the 8th of May, there was 12,657. So we can see there's been an increase in the past week. But week 18, the week ending the 1st of May, there were a much larger number, 17,953 deaths. But even this figure here, the 14,573, is above the national, the 5-year average. So the 5-year average is just over 10,000. So that we can see the excess deaths around about 4,500 in this most recent week where we have full data. So week 20, there was 3,810. That's 26.1% of all deaths mentioned novel coronavirus COVID-19. And as we've said, 95% of those would be directly attributable to the COVID-19. So the number is going down. The direction is currently good. Now, so far in the UK, there's been 54,000, virtually 54,000 excess deaths in England and Wales from the start of the outbreak to the 15th of May. Now, this is all excess deaths, the totality of excess deaths. Now, we know that the majority of these are from COVID-19, but we know that sadly people have been dying more than they normally die from other things as well. In fact, we could look at a graphic that illustrates that now. So on this graphic here, what we have, the majority of excess deaths compared with a 5-year average have included COVID-19. So this line here, if you can see that line, that 0 line, that's the 5-year average figure for deaths. So we see that here in January it was slightly above, and here it was slightly below the average figure for total deaths. And then as COVID-19 got started, we see that the blue line, which is the COVID-19 deaths, increased. Now, of course, all of the deaths attributable to COVID-19 are above the 5-year average, because on the previous 5 years there hasn't been any deaths through COVID-19, so they're all above the 5-year average. But we also notice there's a fair proportion of additional deaths which are not attributable to COVID-19. So there have been these additional deaths as well. And the reasons for this are many, but one of the reasons for this is that people have been reluctant to access healthcare. It is probably as simple as that. So there's been an excess deaths altogether, or healthcare has not been as available as we would like it to be. So we notice that there's excess deaths in addition to the COVID-19 deaths. Now, that comes to a total of 53,960 excess deaths in England and Wales from the start of the outbreak up to May 15th. So that's a lot. So this 53,000 includes the deaths from COVID-19 and the excess deaths from causes other than COVID-19. That's including both lots of deaths. Now, we know that the initial figures we gave don't reflect the actual status of things in the UK at the moment, but the current status of COVID-19 symptoms is given by, or a very good estimate is given by the King's College London and the Zoe collaboration, which is available there now. This is an app I've got on my phone, and I would encourage you to download it as well. There's about 3.8 million people now contributing towards this data, so it's getting very useful amounts of data. So combined antigen testing and reporting data, people reporting clinical features on this app, which are adjudged highly likely to be COVID-19, adding that to the cases confirmed, gives us 9,900 new cases of COVID-19 in England per day. So basically we're getting just under 10,000 new people developing COVID-19 per day. Now the real number is higher than this, because this is excluding care homes. And of course, well, not of course, but it is excluding asymptomatic cases. The only asymptomatic cases which will be picked up in that figure are those who were positive, who tested positive, despite being asymptomatic. So given that perhaps half of the cases are asymptomatic, the real number of new cases in the UK is probably 20,000 per day, although we're not quite sure about that. But from the testing and from the clinical reports from the COVID app, 9,900 new cases per day. And this is based on nearly 1 million people using the app. 900,000 people using the app. Just under 1 million people using this app. And of whom 18,000 were presenting as COVID, positive or symptomatic for COVID. That's where this number of 9,900 comes from. Now, I would encourage people to download this app. There's 3.6 million users across the USA, UK and Sweden. And it's not a tracking app. There's nothing Orwellian about it. You just report in every day and say how you're feeling. It's that simple. Now, England, all areas are seeing new cases. Well, you would expect that. The virus hasn't gone away. So all areas are seeing new cases. But in the north, so the epicentre in England has now moved from London to the north of England. The northeast and Yorkshire particularly. So we're going to see different shaped bumps in different places. So the London curve might have been here like this, and now we're seeing the more northern curve like this. It's just happening later on in time. So different areas, different countries getting more cases at different points in time, and this is what we would expect, really. So now these figures, this 9,900, this gives an up-to-date view of COVID infection rates. So this is like live data. This is, I guess we might call this nowcasting. It's the situation now. Whereas before, we've been inferring the amount of deaths at a particular date. So we've been inferring the amount of cases at a particular date by looking at the deaths in a month's time and looking back and saying, oh, that means there must have been so many cases. So now we're at a more advanced stage than that. We've got the live data now, so we're not having to wait for a month because the deaths lag by about a month. But of course, what this also means is that we could work out how many deaths there are going to be in a month's time also. Just looking at a little more data from the Office for National Statistics now. This is the number of deaths involving COVID-19. Was highest in women aged 85 and over for the third week running. Okay, this is interesting. Now, we see few deaths from COVID-19 in the younger age groups, thankfully. Very sad to see some in the 15 to 44-year-old age range. But in all age groups here, 75 to 84, for example, we see more men in blue than women in yellow. We see more. And this is what we've come to expect, that more men are dying, getting complications and dying than women. But then in the older age group, that's been reversed now for 3 weeks, where we see more older women dying compared to older men. Now, I think the reason for this is probably fairly simple. The Office for National Statistics haven't said. But I think the reason for this is that by the time you get to the over 85 age group, women live longer than men. So a lot of the men here have already died. So there's more women aged over 85 than there are men over age 85. Therefore, the numbers of them that are dying are higher. Now, if this was adjusted for the number of women and men in that age range, I suspect it would be more men than women dying. I don't know that, but that's what I would suspect. But that's the data we have now from the Office for National Statistics. And this is the graph we've looked at for a week or two now. This graph here. So this is showing that just over half of the COVID-19 deaths that occurred in week 20, that's the week ending the 15th of May, happened in hospital. So the blue lines here are deaths in hospital. The brown ones are at home, the blue ones are others, and the red ones are in care homes. So what we saw here was the proportion of deaths occurring in care homes was increasing. But now the proportion of deaths occurring in care homes is decreasing, as indeed the total proportion of deaths is decreasing. So we see the effects of the lockdown now quite dramatically demonstrated in the reduced number of deaths. Reduced number of deaths in hospital. So of course, still way more deaths than we would like in care homes, but the proportion is coming down. So the direction of travel is good there. Now this graphic here is about the number of deaths registered in the UK. The total number is increased, while the number of COVID deaths decreased in week 20. So that's week 20, that's the week beginning. That's the week ending the 15th of May. That's week 19 the week before, week 18, week 17, all the way back to week 11 of the year there. And we see that the COVID deaths here in brown started then. And we see that the proportion of COVID deaths, the number of COVID deaths increased. But now we see the number of COVID deaths is decreasing. And indeed, initially that was reflected in the total number of deaths. But then in week 20, the total number of deaths was actually slightly higher than the week before, even though the number of deaths from COVID-19 was less. So that's some interesting data from the UK. Now, I've got quite a lot of other things to show you, but I want to try something a bit different just before we do that. Now, if you want to skip this bit, you can do, but it's interesting. So what I want to show you is some infographics from Ag Unity, which we're going to look at again later. I want to play you some music by Diane Lindley, and I want to look some artwork by David Downes. So let's listen to the music by Diane and look at these graphics.
We live in unprecedented times, and although we may be apart, we are not alone.
COVID-19 is spread, millions sick, many dead, fills my mind with dread, makes me want to stay in bed. But there's so much we can do, it's up to me, it's up to you, and actions we take, starting today. This virus will not beat us, in time we will defeat it. Things will get better in this. We're in this together. Firstly, if you please, cover your mouth when you cough or sneeze. Secondly, realize to touch your nose, mouth, or eyes.
Kindly ask, wear a mask.
This virus will not beat us, in time we will defeat it. Things will get better in this. We're in this together.
Dr. Henry's on the 3.
Thirdly, our greatest hope is how and when we use a soap. Lather up real good, just like a healthcare worker would.
Wash hands well for 20 seconds.
This virus will not beat us, in time we will defeat it. Things will get better in this together. So stay safe, stay at home. No, you are not alone. Where you are, do your part.
The future,
it starts today. We'll find a way. This virus will not beat us, will not defeat us. Things will get better in this.
realities of family.
Things will get better.
Humanities of family.
We're in this together.
So I just want to thank Diane Lindley for sending that in from British Columbia in Canada. Thank you, Diane, for that lovely song. I'm sure many will appreciate that.